Dr. Manuel Anton, new CEO of Mercy Hospital, envisions Miami as a medical mecca, where Miamians wouldn't leave to get health care, and folks from around the globe would think of Miami when they needed it. And he wants Mercy to be an integral part of that. Over the recent years, Mercy has increased its technology and shortened its emergency room wait times, and he wants the world to know. Dr. Anton joins us for this week's profile. I'm Risa Polanski, reporting for Miami Today.
You know, the national healthcare reform brings a dilemma for all of us in healthcare, because on the one hand, all of us that have been involved in healthcare, either on the clinical delivery side, the professional side, or the organizational side, know that there are deficiencies in our system in our country. We are looking to increase access for individuals. We don't like it when people have to come to the emergency room when they could have been taken care of by a primary care physician, and they didn't go to the primary care physician because they didn't have access or insurance. We know that there are delays in treatment, delays in diagnosis, and so on and so forth. The system wasn't totally broken in that, you know, the emergency rooms take care of anybody who comes in and so on and so forth. So that care was there, but that's not necessarily optimal care. You don't want people coming in when they're really that sick that they need an emergency room. Okay, so there's this whole interest in creating better access for our communities and for our nation. On the other hand, there's all this concern about how that is done. You know, is it done under the government auspices? You know, the concerns about if Medicare and Medicaid have had the trouble and the difficulties they've had, will now bringing a larger part of the healthcare industry under the same governmental purview lead to the same kind of problems. You know, Social Security broke, Medicare's broke, Medicaid's broke, will all of healthcare go broke? Those are very big problems. At the community level, we need to influence those. I don't think we're going to be able to solve them. The question for us is going to be, are we going to be able to deliver the kind of care we want to deliver to the number of people we need to deliver that to under the new healthcare regime? We don't know the answer to that yet. I suspect that as a nation, what we're trying to do, and this may not be the right way to do it, but I think the intent is correct. What is the intent? The intent is to make sure that more people have access to health care. And that can only help our country because it reduces the rates of injuries, suffering, lost work, productivity, and so on and so forth. So all of those things are beneficial to the country. Will it work? That remains to be seen. And what I'm hopeful is that the elements of this that don't work will hopefully be changed. And the elements that do work will retain and enhance and improve on. And like I said, you know, my philosophy is try to find the best part, you know, and then make that better. And I'm hoping that there will be good parts of this where if more people are insured, more people will take care of their health, more people will see physicians rather than waiting until things go wrong. And in the end, that may diminish the costs. It may. Maybe.